kids and COVID-19. Are kids spreading it to each other? One doctor weighs in. Good Day Charlotte on Fox 46 at 7 starts right now.
Good morning. You're watching Fox 46. Good Day Charlotte.
Kids and the coronavirus. Are kids passing the virus from one another? Are adults passing it to kids and vice versa? Well, joining us to answer so many questions, pediatrician Dr. Anna Maria Temple. Dr. Temple, good Tuesday. How are you?
Good to see you. Great Tuesday.
It's nice to see you as well. Thanks for giving us a little bit of your time this morning. Every week, new questions, new stories continue to arise because of COVID-19. And right now, we kind of want to talk about kids. You know, there's a big announcement coming today with the governor about schools, what the plans are this fall, and everyone's got their own opinion about this. But let's start with parents. We're worried about kids, right? Can kids pass coronavirus to each other?
Well, you know, now that we have significant amount of data to show that actually children are not the carriers of this. This is just came out in the journal Pediatrics, which is a major journal. Its studies are coming out of China, out of France, to show that children are not the spreaders. What we know is that we know flu and cold season. During those times with those viruses, children spread those viruses to adults. So we're thinking that that's what happens. When in fact, with COVID-19, that is not the case. The parents or the adults are actually spreading it to the children.
Oh, okay. So what's sort of the age cutoff when we're calling children children, okay? Because now we got middle schoolers, now we're talking high school. Like when we say children aren't really carriers, where does that kind of cut off, you think? Teenage years?
So that is so great. But when we look at all the different things that were done in other countries based on school openings and such, it looks like in the daycares and elementary school, that has not been a big issue of the children spreading it to adults. Now we're seeing that in the middle schools and in high schools, there's much more spread between the children and the adults. So, I mean, as far as the cutoff, we'll probably say teenagers is kind of like, 11 and up seem to be an increased risk of spreading it, where the kids younger than that are not doing that.
Well, and maybe that's why there's so much confusion and worry about going back to school, is because you hear things like, well, kids can't carry it. Okay, why can't elementary students go back to school? But maybe they can get it from the teachers or the staff or something like that. So there's not a perfect scenario. It's like we're making this up as we go. What do you, I mean, I know the whole going back to school, the decision doesn't rest on your shoulders. Thank goodness, right, Dr. Temple?
Thank goodness it doesn't rest on my shoulders. But here's the thing. So the children are going to get it, right? And we are walking around thinking that we're protecting ourselves, so we're never going to get this. No, this is going to spread through the community until about 60% of us have it. And then we're going to be able to protect the vulnerable population. That's called herd immunity. But until that happens, we're going to keep on spreading it. But here's the good news. When the children get it, they are not that significantly affected. If we look at the numbers from June 1st, so in Charlotte specifically, and this comes out from the Charlotte Pediatric Society meeting that happened a week and a half ago. So in June, since June 1st, in Charlotte, we had 25 children being hospitalized. Mind you, in Charlotte, we have 212,000 children. So out of 212,000 children, 25 were hospitalized, with 15 less than 1, 4 between 1 and 4, 3, 5 to 9, 8 of them 10 to 14, and 7 over 15. And everybody did fairly well. The other thing that people are absolutely paranoid about is the multi-system inflammatory condition of childhood, which is all over the news. So I'll give you some numbers real quick. In the U.S., we have over 70 million children, and 250 of them have been affected by this.
Oh, wow.
In North Carolina, 9 children have been affected by this since the beginning of COVID. If we look at the numbers, we can breathe a sigh of relief.
Well, breathe it through a mask. How about, and I know everyone's got their own thoughts about the mask, and we're going to talk about more with you next week. I know you're like, don't even get me started. But this is part of what parents, I think, are freaking out about, because if the governor announces today they are going to go back, whether it's full-time back in class or part-time, whatever the mix happens to be, they're saying kids, elementary school kids, need to be wearing a mask. What are your thoughts on that?
It is so incredibly tricky. because we're talking about, they're looking at Asian countries and they can do it. We are not an Asian country and we don't work the same way. And there's studies on both sides saying that, that we can put masks because it can help spread the disease. You look at other studies that says it makes absolutely no difference in wearing the mask. And we can go back all day long on this. The issue in elementary school kids is going to be the message that we're trying to spread to them. I'll tell you, I think the biggest thing I'm seeing is that fear from the teachers. For the kids, it's just going to be a cold. You don't close a school because kids get a cold. You don't close daycares, but the paranoia and the fear is the problem. And I don't know that a lot of teachers are going to go back to school. I have no idea. I'm not an educator. I only have a couple of friends and family members, but what I'm getting is that people are just so worried and I'm going to go to school and we're going to spread it to each other and then we're all going to die. I mean, that's really what the fear is out there, and no one can wrap their mind around the fact that most people, so 45% of tested people that walking around are asymptomatic carriers, and children just don't carry this. When a sample in Charlotte, they did a random sampling of asymptomatic children and only 5% of them actually were carrier of COVID. What does that mean? That means the rest of the kids that are walking around with no symptoms are not carriers of COVID. And if children end up having the way they spread it is in the first 2 days of illness. So the day before, a little bit of spread, tiny little bit, but they have to be ill in order for them to legit spread the illness, which we can do that, prevent that with a lot of screening and making sure that their parents don't send kids to school that are feeling unwell.
Whew, Dr. Temple, man, we need about an hour set aside to be able to go through this. Thank you for answering some of the questions. We're going to continue this later this week and next week with you as we continue to get more answers and wait to hear back from the governor. Thank you for your time. Appreciate it. Have a great Tuesday.
So great to be here. Stay well.